Hi, my name's Sarah O'Donnell. I'm the Primary Care and Integration Lead for LCH, and today we're going to talk about what's new in vaccine. So this is a very quick guide just to go through some of the vaccine changes that have happened in September onwards. Just remember, you still need to make sure that you do your vaccine update training, and there are many of them available. Have a look on the GPIP and contact your surgery practice manager. They will have the details as well. So everything that we talk about is tracked to the minimum standards. So this will just help you understand what you should be doing in practice as a nurse or HCA who are then doing the vaccines. So we'll start with influenza. Obviously the season has had a little bit of a stall, meaning that we're starting from October to try and get the COVID and the flu vaccines together. But as you can see here, these are the cohorts which you will be doing this year. And there is a slight change because the main one is that we've dropped the 50-year-olds, which is what we had previously and because of COVID. Just a reminder as well that people that are carers are eligible and they may not be coded as such on your screen. So make sure that you are asking those questions of people. If they have a relative or a child that they're caring for, they still can have that flu jab. These are the different ones that we also have in practice. So remembering the children's vaccines as well. Like I say in your update, you will go more in depth in these. Just to make sure that you remember the eligible cohorts of children where the parents do not want them to have the nasal flu are able to have the injectable, but you must order that off Inform and not use your other stock in that case. There are lots of different types of vaccines that we give, so make sure that you have a list and a way of checking which ones you are giving, and this is a really good resource to help you with that. So you can download that at the gov.uk website, stick it on your fridge, cross out the ones that you don't have, make it easy for everybody in your surgery that are giving these to stop us having any issues and any medicine errors in the flu season, because we know it goes quick, we know there's a lot of information we have to get through. And all the key documents, again, are on the gov.uk website, and many of these are also on the GPIP, led by the GP Confed. Quick reminder, peer-to-peer vaccines. So we aren't able to give vaccines to each other in primary care. We have to have a written instruction in place if we wanted to do so. So please make sure you keep yourself safe, have this in place so that you can then give those vaccinations in practice. Another big area that's changing is the shingles vaccine. So as you know, we've got the Zostavax at the minute that we use, and we're going to continue to use that until we run out of it, basically. They will still be used for the same cohort that you are using them from now. The new cohort and expansion is the immunocompromised cohort, so people from the age of 50 onwards. There will also be an expansion of the immunocompetent, which is basically everybody else, who will be offered the Shingrix, which is the 2-dose vaccine, and that will be from 60 years of age and over. Now, it seems quite complex because there's lots of different people that need this vaccine, but there are some really great resources to help us with that. So this, again, is just a very brief spot-by-spot way of going through who will be getting it in general practice and what our responsibilities are. Please do notice that the weakened immune system, so the immunocompromised patients, have a slightly different booster schedule to everybody else. So that's really important you get your recalls in place for that. And this is the timeline. So people that are 70 will get that within the first year, and people that are 65, again, in the first year of this. So next year, the 69, 68, 67, 66. So as you can see, go by the date of birth, it will tell you what year they'll be eligible, and that's when you give that vaccine. There is also discussions about if you can give shingles and COVID together, and you can. This is just that information on the national protocol that reminds you that you are able to give them together now. You do not need to wait 7 days. More information and all the guidelines and stickers and easy read documents are all here, really useful to use in practice. So please do download them. They're all freebies, so get them in practice and get your clinics all sorted out as soon as you can. COVID vaccine pro. So this has just been announced, hasn't it, in the past few weeks. So we know that these are now the autumn cohorts, which includes us as healthcare professionals and all the people you see listed here. You may or may not be doing COVID in your practice. You may have a hub, but wherever that is, just being aware of how you then let patients know if they are eligible or not. Again, really good idea to print this off and just keep it with you so you know when people are asking you. And if you are doing joint clinics, you can give, like I say, the shingles, the flu, and the COVID. So whatever works for you in practice. And for anybody who has not had any COVID vaccines at all in the past, this guidance just lets us know that we just offer a 1-dose booster. We do not start from the beginning. And so that's just that extra information there for you. Another change that we have is a HPV vaccine. Now, mostly this will affect the school nurses rather than us in general practice, but it's just to make us aware that it is now a 1-dose schedule for the routine adolescent programme, okay? Also, the Men That Have Sex with Men programme is also a 1-dose vaccine before their 25th birthday, but the majority of the other ones that you can see on there are given obviously in the Sexual Health Service or by the school nurses. For any vaccines that can't be given in schools, remember, it's our responsibility to help them access vaccines. And if they have any issues, learning disability, autism, a real needle phobia, then we can do that in practice for them as well. Some more resources I just wanted to share very quickly with the migrant health and accessibility resources. Really good because we have a massive multicultural area in Leeds. These are really great QR codes. You can put the routine schedule into their language for them, just to help them understand what they are getting. And again, there's leaflets for them in lots of different languages. But remember, not everybody reads and writes, even people that speak English and have been living in this country for many years. So always think first, do I need to talk to them through this? Do I need an easy read? Before just giving out lots of leaflets. So I just want to finish with cold chain, just as a reminder for everybody. So remember, checking your temperatures at least once per day, ideally twice. Always reset your fridge afterwards, so make sure you know how to set each individual fridge. And if you don't know, double check with the manufacturer. 2 to 8 is the range that we have to sit with. Anything over that needs to be documented. And if it has been out of range for over 20 minutes, then that would be a cold chain incident. We should deep clean our fridges twice a year, and ideally fridges should have a clean door. However, that is a cost in practice. It's just one that we should try and get them if we can. If there is any stability issues, these are the documents you need. This is the data loggers. You need to be talking to the manufacturers if you have a cold chain breach. But hopefully with everything else in place, that won't happen. And this I'll let you have a read of a little bit later. So minimum requirements that you need in practice for your vaccines, and remembering that you have to monitor, read, record, reset and react. You have to have validated cool boxes if you're going to carry your vaccines around. You have to keep up to the routine maintenance and audit your fridges regularly. This will also stop any human error that can happen. Obviously, we know that can happen with incidents, but just make sure that you have audits, make sure there's no out-of-date vaccines in the fridge, and that can just help that. And you must have at least 2 named trained people to be responsible for ordering, receipt and care of vaccines, and that should be 1 from a nursing team and 1 from management. And here are just algorithms to point you to in case anything does go wrong. And if there is any issues and you have to dispose of vaccines, remember you do have to keep a log of those as well.